Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at Smile Design Studio in Bethesda, Maryland, discussing the prevention of facial trauma and how you can minimize and even eliminate facial pain with a mouth guard with two of this area's top dentists, Dr. Michael Wright and Dr. Treva Willis. Dr. Wright received his Doctor of Dental Surgery degree from the University of Maryland and received his specialty certificate in prosthodontics from the University of Maryland as well. Dr. Willis received her Doctor of Dental Surgery degree from the University of Maryland and has further enhanced her training and education in TMJ disorders at the world-renowned Pankey Institute in Key Biscayne, Florida. Welcome, Dr. Wright. Welcome, Dr. Willis. It's a pleasure having you both on today.
Thanks for having us.
I wanted to begin with you, Dr. Wright, and ask you if you can please tell us what a customized mouth guard is.
A customized mouthpiece is actually a guard that's fabricated specifically for that individual patient, whether it's a contact or non-contact sport. This is achieved by doing a very thorough examination. In doing so, that examination involves making certain that the muscles of mastication, or basically the muscles of chewing, are all in balance. If you can imagine a force being introduced, we want to dissipate that force by buffering it instead of actually absorbing the force, which could cause traumatic injury to the disc, the condyle, or actually to the base of the skull, resulting in such a concussion.
Sure. And obviously that's a hot topic these days, concussions in sports.
Absolutely. Especially in NFL.
Yes.
So as we know, the balance of the muscles are very important. And you have to remember that a lot of these patients are starting off very young at pee-wee football, 5 or 6 years of age, through high school, on to college, and then perhaps the pros. So there are a lot of predisposing factors of trauma that's been involved. And some of these are overlooked. And that's why a thorough examination of the musculoskeletal system is very important.
Yes, indeed. And on that note, I'd like to see if you'd like to add to what Dr. Wright just said, Dr. Willis.
Sure. It's very important to identify any pre-existing conditions before we start making the customized mouth guard for the patient. We like to utilize a CT scan or MRI, muscle and joint examination to find out if there's any disc disorders or muscle disorders that will affect the patient's performance before we customize the mouth guard.
Why is it, for our viewers out there watching right now, would you say, as a specialist certainly with all your training and experience in this field, why is it so important to wear a mouth guard?
Well, I've seen a lot of mouth guards out there. The key word here is customized mouth guard. A lot of the mouthpieces I've seen are made out of a very thin material, where earlier we talked about exacerbating that force or dissipating it. With the materials that I'm seeing out there, they're not dissipating at all. So the patient is actually absorbing that force. So the key is to have a mouth guard that's customized to balance the jaw, to protect the teeth, and to act as a buffer.
Can wearing a mouth guard help those who suffer from prior facial trauma?
Yes, it absolutely can. Wearing a mouth guard can help to treat people who have current facial pain and also suffer from joint disorders. It's important to remember that soft tissue injuries typically precede hard tissue injuries. So what we can do with the customization of an athletic guard is to arrest any current damage that's existing and prevent future damage from occurring.
Very interesting. I appreciate you letting us know that.
Not to interrupt you, but remember there was a patient who came in just the other day, a housewife, not a pro football player or someone who was involved in contact sports. But you remember, during times of stress, during the economy, people clinch and grind. So that phenomenon within itself is equivalent to someone getting hit with a lot of pounds of force. So in patients like that, your everyday patients, we want to offer some sort of help. And in doing so, we don't need an athletic guard, but we use as a therapeutic splint that will take a lot of the load off of the skull, relax the muscles, take a lot of load off the teeth, and create that equilibrium so that everyday person can enjoy the same quality of life as everyone else, pain-free.
Yes, indeed, and still be very active and participate
Yes,
in a very busy, if not potentially physical-oriented type of exercise or sport.
Exactly.
Now, speaking of sports, I understand you have a very famous patient, among others, here at your practice, and his name is D'Angelo Hull. For all our viewers, I'm sure, who aren't familiar with him, he is a starting cornerback for our Washington Redskins. And I wanted to ask you, Dr. Wright, I'm sure the customized mouth guard that you certainly have given him and provided him with has been very helpful in his career.
Absolutely. What's really interesting about this is I won't put any names of any brands, but he came in wearing another mouthpiece that was not so customized, and we were able to equilibrate his existing musculature, and in doing so, we increased his range of motion. We were able to balance his skull, so we achieved balance as well as increased range of motion, and we made it very pleasant for him. It was something that was very adaptive, which means they can breathe. It wasn't too bulky, and to make it really interesting is that he was able to customize it itself. He was able to put which designs he wanted, with numbers, with color scheme, etc. So it's fun for both of us. Fun in the fact that he was able to fabricate something that he wanted, and fun for us to know that we're actually protecting the patient on the field. So it makes watching that Sunday or Monday night football game more enjoyable.
We're now going to meet a couple of patients of Dr. Wright, and I think you may recognize them. Welcome, Vince.
Thank you for having me.
Well, folks, for all of you who may not know, this is Vince Fuller, cornerback, safety for the Tennessee Titans pro football team in the NFL, local guy from Virginia Tech. We're very honored to have him on as a guest. He's also a patient of Dr. Wright. So let me just begin by asking you, Vince, you have a mouth guard and that Dr. Wright fitted for you, and I wanted to begin by asking you if you can please tell us about it and all that was involved with it.
Okay. Well, Dr. Wright came to me earlier this season, talking to me about mouth guards, and as you all know, there's a very big emphasis on concussions and protecting, NFL players from concussions. I've seen people take hits and get concussions, and it's a situation that when you see somebody laying on the field, sometimes looking motionless, it's a situation that myself and I'm sure other players would never want to be in. So when I heard this information, I immediately came to Dr. Wright's office, got fitted for the mouth guard, and I think what sold me on it was that it was a fit that was unlike any other that I ever had with the mouthpiece. You know what I mean? I've had mouthpieces made by dentists, that work for my team. I've had mouthpieces that I've just bought from the store and put in boiling water. But this one, he actually fit for the jaw, for my jaw, I should say, and it was almost a custom fit. So when I put it right in, it was almost a click, and you could tell that it was aligned in a position where if I took contact, it would be a situation where I felt I would be safe.
So it gives you the protection. It was custom fitted, like you just mentioned, Vince, as opposed to the ones that the team doctors in the past or team dentists had recommended, or you can buy off the shelf. This one just gives you that real fit, that you just felt that confidence wearing it.
Absolutely. You know what I mean? Like I said, it was a little more precise than what we get from other places where we aligned our jaw and had us bite down to make sure it was the perfect fit. And funny thing is, the first day I wore it was the first game I should say was against Jacksonville, and I took a hit that actually jarred my helmet off from a teammate of mine. And it was one of those times where
friendly fire,
right? Exactly, friendly fire. And it was one of those times where you feel like, man, this shit hurt. Yeah. But I had the mouthpiece in and I laughed, and I texted Mike after the game like, this mouthpiece might work. You know what I mean? So the WrightGuard was definitely something that I felt paid off, instantly for me.
That's right. And like you just said, you just found out right away because the first game against Jacksonville, like you just described, Vince, that type of a hit. If you're wearing the other mouth guards that you wore previously and that most players wear, you might have really maybe had some concussion-like symptoms.
Could have had some serious damage, exactly.
Instead, you just got right up and you were ready to go and you felt fine.
Let's play football, exactly.
That's it. That's great. I'm so happy to hear that. Now, when you came to Dr. Wright, what was involved as far as getting when you came for a consult? Okay. What was the process?
Well, the first thing he did, we went into the dentist's office, I guess you should say, and he did a fit or a mold of my teeth, both upper and bottom lips. Then he made the mouthpiece, and I had to come in and get it fitted, like I said, programmed so that it fits exactly with the bite in the position that most players are in when they get hit. So it was a bite that you take, and he tells you to relax your jaw and then bite down and tense your jaw up and things of that nature. And based on that, he either shaves a little bit off or adds some more protection in certain areas. And you know what I mean? I just felt like it was a great process. You know what I mean? And not to mention, you can get it custom made and and make it look the way you want to, if your team colors on it with a little bit of design and things of that nature. I think that also adds into the process.
It's personalized.
Exactly.
It's yours.
It makes it yours. You know?